Hello, friends and haters. This is Lenny of Lenny Does Rants. www.lennydoesrants.com. Sports, politics, religion, engineering, technology, and science. But I feel free to rant about anything I damn well please. Welcome to another segment.
So for today's rant, we're going to talk about prostate cancer, a really funny subject. Well, no, actually, it's not a funny subject at all, but maybe we can use a little comedy to educate. What do you think? Did you know that each year in the U.S., more than 30,000 men will die from prostate cancer? 30,000! Sounds like a pretty damn big deal to me. How about you? You know, we need to talk about the good news. And the good news is, if prostate cancer is discovered early enough through rectal exams, PSA blood tests, prostate biopsies, and other means, it is curable. In fact, the cure rate is pretty high. So why aren't more men being concerned about prostate cancer? Well, let's talk about things. So men don't have to die from prostate cancer, not if they catch it early and they treat it. But one of the things that comes with prostate cancer treatment is a lot of side effects. And these side effects are pretty serious. It's a pretty big deal. Let me talk about some of them. First, there's erectile dysfunction. Yeah, that's just what every guy wants to hear. And then there's bladder or anal leakage. Eesh. We're talking about having to wear a bag. Yes, not a very funny subject, but a fact. Doesn't happen often, but it can happen. Anyway, maybe the erectile dysfunction won't even matter if you're having anal or urinary leakage, huh? You decide. Another side effect is loss of sex drive. Well, that's not too good either, is it? No. And then we have urinary blockages. There's a goodie. Yeah. One more that isn't talked about very much is retrograde ejaculation. Now, what this is when the semen decides to make a U-turn. Aren't U-turns illegal in most states? Yeah, the semen makes a U-turn and decides to go to the bladder instead of out through Mr. Happy. Not good, but it may be necessary after certain forms of prostate treatments. So, we certainly have a lot of reasons and things to think about here. But we're not done. We're not finished with the side effects. If a man has to have hormone treatments in addition to other forms of treatment, usually radiation, there are some other possible fun side effects. One of them is that the man may grow breasts. Yes, your very own tits. Not something most men want. No. Along with this comes osteoporosis, which is loss of bone mass and bone density. There also can be loss of muscle mass, weight gain, and some other side effects from hormone treatments, such as hot flashes. Yes, men too get to experience the hot flashes that a lot of women have complained about over the years. Gee, isn't that a fun thought? Now let's move on to something else. Unfortunately, we're talking about the discomfort and pain in ways you could have never imagined that can come about during the discovery and treatment phase of prostate cancer. But we need to talk about it. Nobody does. I'm going to. This discomfort starts when doctors or medical technicians need to stick things like scopes, cystoscopes, things like that, ultrasound probes, needle guns, catheters, or whatever, up your butt or through Mr. Happy. Not a good thought, but it may be necessary. So face up to it. Be a man. Are we cringing yet? You should be. And listen, you really haven't lived until it's determined you need a TURP, a transurethral resection of the prostate via the penis. Kind of think about it like Roto-Rooter for your penis. Not a good thought. So, still don't think prostate cancer is a big deal? Well, you're wrong. It is a big deal. Now, at this point, things usually start with the uncomfortable, but maybe not terribly painful DRE, digital rectal exam. Yes, I'm talking about when a doctor has to stick his or her finger up your butt to examine your prostate and look for abnormalities. What a job! Have to stick your finger up somebody's butt. Doesn't sound good to me, but anyway, a DRE. After the DRE, your doctor may order a blood test so that your PSA can be checked, right? And the PSA really, just think of it as there is a protein that is secreted by the prostate. And when they look at the PSA test, they're looking at the absolute value of the number that comes back and also the change in PSA. And that may be more important than the absolute value. Anyway, after this, assuming we don't get the results we're looking for, a prostate biopsy may happen. Now, here's a fun procedure. This is a procedure where a doctor uses a device to grab and examine about a dozen samples of your prostate to check for cancer and precancer. So let me tell you a little story I had about 9 years ago in my urologist's office. You'll love it. So I go in there and my doc sits me down and we're having a discussion and he says, Len, I need to do a procedure. We need a prostate biopsy on you. Now let me explain what this is. He says, Len, what I'm going to do is I'm going to insert a device up into your rectum. I'm going to go through the walls of your intestine into your prostate. And I'm going to take this device and I'm going to get about a dozen samples of your prostate for analysis. Now, Len, it sounds bad, but I don't want you to worry because I'm going to give you a little something to calm you down before the procedure. Well, I look at my doc. I said, Doc, wait a minute. Let me see if I understand. Doc, you're going to take some kind of thing, a needle gun, some kind of device. You're going to shove it up my butt. You're going to shoot through the walls of my intestine into my prostate. And you're going to grab 12 chunks for analysis. And you're going to give me a little something to calm me down before the procedure. Do I have that right? I'm going to need morphine. Anyway, the procedure really wasn't that bad. But it was a little bit shocking when I first heard about it. All right. Now, assuming that things come back from the prostate biopsy and from the PSA tests, and it's determined you do have prostate cancer, and by the way, they will use something called a Gleason score or a grade, which generally ranges from 2 to 10. Hopefully you don't have a 10. Anyway, they use that to determine how aggressive the prostate cancer is. And at that point, the real fun begins, because now you need to pick a treatment option. And buddy, you need to do something if that's the case. None of this watchful waiting crap, or you're liable to be one of those 30,000 men that die. Man up. Pick a treatment. We're going to talk about some. So here are some treatments, and these are only a few. There are more every day. The treatments are getting better. All of them have side effects, as we've already talked about. But anyway, you need to pick one. So the first, and you'll have to excuse how I pronounce things. I'm not a medical doctor, so don't look to me to pronounce things correctly or for medical advice. The radical prostatectomy. I think maybe I said that right. In this surgery, your prostate and any surrounding cancerous tissues are totally removed. This is the most aggressive of the treatment plans, at least in my mind, but it may be the best in catching things surrounding your prostate. Unfortunately, at least in the past, this has come with the highest risk of side effects, especially erectile dysfunction and bladder leakage, urinary incontinence. It's a fact. All right, the second is laparoscopic prostatectomy surgery, or better known as robot surgery. Yes, this is actually performed by a robot under a surgeon's control. When I heard this, I thought to myself, no way, dude. There is no way I'm letting a robot operate on me. I have seen the Terminator movies. I know what those robots are up to. They're going to take over the world. Of course, that's not really true. All right, then we come to external beam radiation therapy. Now, this usually means 40 to 45 days of treatment where you get radiation every day in that treatment. It is not painful, but it is usually accompanied by hormone treatment. And when I say hormone treatments, what I really mean is androgen deprivation therapy, ADT. Now, you can think of this as basically being turned into a girl. I'm not kidding here. I'm not kidding. Yep, you too can grow breasts, gain weight, lose muscle mass, have hot flashes, and oh, by the way, have zero sex drive. It's a fact. All of those are a possibility. Now, generally, the side effects go away after the treatment ends, after a period of time, of course. But there is one case where that is not true. This is a goodie. This is a goodie. And that's called, and I'm sure I'm not pronouncing this correctly, an oreectomy. In fact, a bilateral oreectomy. And this is the extreme case where they basically cut off your balls. No, not me, dude. Not happening. Fortunately, that's an extreme case, and I don't think it's done very much anymore. All right, now we come to brachytherapy. Brachytherapy, or internal radiation therapy, is the insertion of 50 to 70 tiny radioactive things, sources, directly into your prostate. And the way they do that is you pull the scrotum up and you go up through there. That does not sound like fun. But now, when I heard about it, the first thing I started thinking about is, wait a minute. I could just imagine in the TSA at the airport. I'm going through the line, and all at once the bells and whistles start going off. And this big, hairy dude points at me and says, "You, over here, drop your drawers. Joe, go get me the Geiger counter with the long probe. We're going to see where this guy lights up." Ah! That's all I could think of. The next is MRI-guided cryosurgery. This is a procedure that I have had, where they do an MRI first, mapping everything, and then they do cryosurgery. Now, cryosurgery is where they freeze sections of the prostate where there are cancer cells, or maybe the whole prostate. Now we need to think about this, or at least this is what I did. Have you ever had an ice cream headache? You know, you are eating an ice cream cone and you are getting down on that fine, creamy stuff. You're eating that ice cream cone and you're happy as can be. You can't get enough of it quick enough. And then suddenly your head wants to explode with pain. You have an ice cream headache. Can you imagine having something like that down there where your prostate lives and breathes? I couldn't, but I've had that procedure. Now, the last one I'm going to talk about is called high intensity focused ultrasound. But nobody says that. What they say is HIFU. Yeah, HIFU. You know, when I hear that, what comes to mind, HIFU, is some kind of Korean martial arts. You know, where maybe two of these martial arts guys just kick the ever-living crap out of you until your prostate just gives up and falls out your butt. Wow, I always wondered what one of those things looked like. No, that's not what it's all about. What it's about is they put a probe up your butt and using high-intensity focused ultrasound waves, they literally cook your prostate. You know, think of you take a really good steak and you put it in the microwave and you ruin the damn thing. You put it on 10 minutes and you go have another beer and you come back and there's this dry, hard up, stinky, smoking piece of thing that used to be a good piece of meat. And now it's destroyed. Now I got to tell you a little story. When I had HIFU done, you couldn't do it in the United States. You had to go to some other country. So they sent me to Mexico, which turned out to be important. Anyway, I'm there lying down on the table, face down, my legs in a stirrup, my hairy butt up in the air. And I'm thinking, oh, this is not going to be good. And they haven't given me the injection yet to put me out. And out of the corner of my eye, over on a table, I see a nurse or a medical technician doing what I think was putting a condom on this huge phallic-looking device. I can't tell you what was going through my mind. Oh, wait, I will tell you. Of course I will. The first thing I thought of is, now I know why they're doing it in Mexico. Mexico never signed the Geneva Convention against torture, and that's what they're going to do to me. And then the second thought came. Oh, man. I am going to get to experience what it's like to go to prison and be somebody's girlfriend. Ah! Anyway, I had the procedure, HIFU, and it pretty much worked. Okay, so here's some thoughts, guys and girls. Prostate cancer is a big deal. Don't let anybody blow it off or tell you otherwise. Oh, yeah, my uncle had it. It's no big deal. Bullshit. It's a big deal. Go take care of it. Go take care of it. Again, with early detection and proper treatment, nobody has to die from prostate cancer as long as you catch it early enough and you do the treatments. So take care of it, huh? It's a big deal. All right, guys. This is Lenny for Lenny Does Rants, and I'm out of here.